HIV was first scientifically discovered in 1983. HIV is a virus that directly attacks the human's immune system over a period of 8 to 10 years. It can be diagnosed through a series of medical blood tests and has symptoms of a common flu. HIV can later progress to AIDS when the human CD4 cells drop below 200. And although there's no cure for HIV or AIDS, there's enough treatment to live a normal life after contracting it.
HIV can be transmitted through vaginal and anal sex and anywhere that allows access into the bloodstream. This makes anal sex the riskiest because of the lack of lubrication and being more prior to having tears, which makes this virus predominantly in the gay community through the acts of anal sex. Drug addictions can also lead to the transmission of HIV due to the improper sanitation through needles and syringes and the sharing of these with other people. Bodily fluids such as blood, semen, pre-cum, vaginal fluid, anal fluid, and breast milk can all lead to HIV transmission.
How can one prevent contracting HIV or AIDS? One common and fairly accessible way to prevent the contraction of HIV or AIDS is to use condoms properly. Participating in low-risk sexual activities without the exchange of bodily fluids can also help prevent HIV or AIDS. Although accessing it can be fairly expensive, taking PrEP, pre-exposure medicine for HIV, can be a very effective method of prevention. Making sure that you and your partner have been tested and are being tested frequently is a good way to make sure that both of you are safe. Not sharing drug equipment or participating in drug injection can help limit your exposure to HIV or AIDS. And lastly, the only true way to prevent contracting HIV or AIDS is to abstain from any sexual activity.
Negative stigmas that run around HIV and AIDS, such as it being subjected to one group of people, misconceptions or lack of knowledge of it being uncurable and leading to an untreatable virus, can lead to people feeling scared, isolated, and shameful, which may prevent testing. And we are here to tell you that this simply is not true. Being in a long-term monogamous relationship puts you at a very low risk to contract HIV. But HIV does not discriminate, so go get tested.